Hello, I'm Dr. Lali Pateridze, pediatrician, and you are welcome to EuroMed clinic. Today I would like to speak to you about newborn babies. All of us, we know how much joy and happiness brings a new baby when he comes home. At the same time, we always have some concerns and some questions which I would like to help to you and ask today. Newborn baby comes and we know how important it is to give him breast milk. Mommy knows she should breastfeed the baby and how proper way to do it, at what time baby should be fed. At the same time, maybe you already know that baby should be on demand breastfeeding. No hours. You cannot keep 2 or 3 hours in between feeding. Some babies will be enough to take just sucking for 5-10 minutes, and it will be enough for them for 2 hours. Some of them will need to be fed every hourly. So don't be scared and you just follow baby's needs, please. And other important question also, how to keep the baby after feeding. I would like to you to keep the baby around 15-20 minutes, sometimes upright position on your shoulder. And then when baby burps, even immediately, still keep him please another 10-15 minutes. And after feeding, you please keep your baby on his side, once on his left and another time after feeding on his right. So you will have nice shaped, round, beautiful head. And in case mainly he regurgitates, he won't aspirate if you keep him on his back. This is important point. And another is in room temperature, always asking mothers how much degrees, how many it should be at home in his baby's room. It is 24 to 25 degrees is enough. No need to keep very hot and not lower than this. Because newborn babies, they cannot regulate temperature, so they are losing very quickly temperature. So you have to wrap the baby and keep it in room 24 degrees to 25. Another point, when you give bath, please bath every day your baby until 1 year of age. And in the room, when you are giving a bath to the baby, should be around 28 degrees. Water temperature, body temperature allowed 36-37 degrees. And try to keep newborn baby also needs a fresh air. So first time when we'll be taking baby for 5-10 minutes out, and then you can increase daily up to 2-3 hours. If it is good weather, of course, not very windy, not too cold and not too hot. It's accordingly which country you are in. And another point about newborns, when asking mothers how to vaccinate the babies. This is very important things, vaccinations. You know, to prevent lots of diseases we can prevent when we give vaccines on time to the baby. It's also a very important point. So we do accordingly what is WHO requirements, World Health Organization schedule requirements. All vaccines and starting at birth, even at hospital, when you give birth to the baby, will be given first 2 vaccines. We all know BCG and hepatitis B. And then we just follow the schedule, whatever it is, should be given until 1 year of age. Why? Because this is an important moment. This age, babies, they produce better antibody reaction. They've done lots of researches and they have seen that they are responding very good to vaccines, producing better antibody level. This is for vaccinations also, of course, you are welcome and we provide in our clinic. So now another important question I would like to talk about allergies. Of course, you know, very important is preventive. When you start from newborn again age and then you give him breast milk, you will have less allergies for future for this baby, and rather than giving cow milk or any other products. So if when baby starts weaning, also it should be done very gradually. Any kind of food we are introducing to the baby, because liver is not mature yet, so it doesn't have enough enzymes to digest the food. If we will start any food which baby is not able to digest, so of course we'll be increasing his antibody levels, which for future also works for allergic, he will get more allergies. So this is very important moment. Please do not start any food and just go gradually. When your pediatrician, you come and you ask them questions, which kind of food should be started and how it should be. And when later on we have few kind of allergies. It might be skin allergy, it might be just allergic rhinitis, it might be even bronchial asthma. Of course, very important is genetical. If he had parents having same diseases, we can expect baby can have. But also we will try to avoid to not reach to this point when we need to treat. So always please remember to make the prophylactic of these diseases. Do not expose. If already baby exposed and already we are having some allergies, which we can still provide treatment, and especially about bronchial asthma, I would like to just ask you, please do not miss the moment and do not deny that baby is having asthma. Nothing dangerous in this if you know the diagnosis. It is good. Just face it and go for help. Because we can still prevent a child to grow out of this asthma and to not have any lung damages when we have proper treatment for prophylactic of the allergic reaction as bronchial asthma. The next topic I just want to talk about the hygiene. Hygiene is at home, at school, in kindergarten. Mothers should always teach child. First we start with please pacifiers. If you can get rid of pacifiers as early as possible, because this is also one source of infection. And sometimes children just keeping sucking their fingers. This is also, please don't let them do this. It's bad habit. Why? Because we can avoid around 80% of infection if hands are clean, if especially they are not putting into their mouth fingers. So you can avoid lots of infection this way. If you remember, last year was a huge H1N1 flu infection. And I'm glad actually from one point that people start more carefully washing their hands, and they are having a sanitizer. Even kids, they now know that they should have sanitizer in their handbags. So this is very important. Hygiene. Hygiene, same point at home. Always when in little baby and the infant crawling, you please keep surfaces clean. With the special sanitizers, which is proper for babies. If they, for example, the children, they love to take toys into mouth, so clean with safe sanitizer these toys. So just wash with soap and water. This is important points. And refresh the air. Refresh your rooms where baby is sleeping. Even if you are using AC, it is hot, still for 2-3 times a day, you please. If you have AC in your room, of course, also you should clean it often, or just if it is central AC, call maintenance to clean the filters. This is also important, that they are sources of sometimes fungal infection, viral, or any other bacterial infection also.